Subscribe for your daily OT brain warm-up. Maria, who has a right transhumeral amputation and uses a body-powered prosthesis, is practicing dressing with her occupational therapist. She is learning how to put on a button-up blouse independently. Which of the following techniques should the therapist teach her to use first? C. Don the prosthesis through the sleeve first, then insert the intact arm last. Jordan, who has a left below elbow amputation and uses a body-powered prosthesis, is learning to remove a long-sleeve shirt independently. Which compensatory strategy should the therapist teach first? B. Remove the sleeve from the intact arm first, then remove the prosthesis last. Noah, who has a right below elbow amputation and uses a body-powered prosthesis, is practicing household management tasks during an occupational therapy session. The therapist asks him to place clean clothing on hangers to improve bimanual coordination. Which strategy should the therapist teach first? D. Use the prosthesis to hold the hanger steady while the intact limb places the clothing on it. Ethan, who has a left transradial amputation and uses a body-powered prosthesis, is practicing dressing skills during an occupational therapy session. The therapist is teaching him how to fasten his belt using both limbs. Which compensatory strategy should the therapist teach first? B. Stabilize the belt with the prosthesis and push the belt through the buckle using the intact limb. Liam, who has a right below elbow amputation and uses a body-powered prosthesis, is practicing tying a bow during an occupational therapy session. Which compensatory strategy should the therapist teach first? A. Use the prosthesis to stabilize lace and the intact limb to manipulate and form the loops. Owen, who has a left below elbow amputation and uses a body-powered prosthesis, is participating in an occupational therapy session focused on dressing skills. The therapist asks him to button the cuff of his intact sleeve while using adaptive equipment. Which strategy should the therapist teach first? B. Use the prosthesis to operate the button hook while the intact limb holds the cuff steady with the fingertips. Learned something or nailed it? Follow us to stay OT sharp. You got this.